leave our Dr. Nye. And remember to write down questions that you have, so after Michelle's presentation, we can get your questions and get those answered by the panel. So next, hold on, we have Michelle Tracey, our patient warrior, who's going to be sharing her presentation with you. Michelle is a preschool teacher turned patient advocate whose mission is to empathize, educate, and empower the millions of people living with migraine disease. Drawing on her English degree from the University of Massachusetts, as well as her extensive personal and professional studies of psychology and mindfulness, Michelle is a blogger, a freelance writer, and a speaker who partners with a variety of organizations. She currently sits on the Miles for Migraine Patient Advisory Board, the National Headache Foundation's Patient Leadership Council, and serves as a partner moderator for the American Migraine Foundation's Move Against Migraine Facebook group. She also collaborates with the Association of Migraine Disorders and the Coalition for Headache and Migraine Patients and the U.S. Pain Foundation. Welcome, Michelle.
Thank you, Katie. Everybody, okay, yes. So as Katie said, my name is Michelle. You may know me better as the Migraine Warrior. That is sort of my advocacy name on social media. I want to do a quick little roll call. How many people in this room are living with migraine disease? Okay. How many are living with episodic migraine disease, which is less than 15 headache days per month? Okay. And how many with chronic migraine disease? Okay. Me too. Do we have any folks living with cluster headache? Not today. Okay. And any other headache disorders like new daily persistent headache? Okay. Welcome to all of you. I really appreciate you being here. I know that coming to an event like this takes a lot of planning. It takes a lot of effort. And so I really appreciate everyone who's here. How many caregivers, real quick, do we have? Excellent. Thank you so much for being here. I am here with my mother, Kathy, who is sitting at the front table. She's one of the reasons I'm able to be here today because I had a migraine attack last night, actually. And so I'm going to talk today a little bit about my personal story and how mental health and mental illness and stigma fit into that story. So I was diagnosed at 13 years old with generalized anxiety disorder, obsessive compulsive disorder, and panic disorder. At 19, I was diagnosed with chronic migraine disease, and in the year that followed, I was diagnosed with depression. I know that oftentimes in our community there is sort of a chicken and an egg situation of which came first. Did the migraine disease come first? Did the anxiety and depression come first? And for me, it was a bit more cut and dry. You know, I knew that the anxiety and the OCD and panic disorder had come first, and then the depression seemed to be a result of the migraine disease. I was diagnosed the summer before my sophomore year in college. It was in 2004, and it felt very much like my life had changed overnight. I went to the ER because, as has been mentioned, we thought I was having, a brain aneurysm or some sort of thing because we had never, I had never experienced that level of head pain and nausea and vomiting and the sensitivity to light and sound and smell. And I actually got very lucky in the ER. The doctor who saw me had personal experience as well as professional experience with migraine disease. And he did all the tests, and then he explained to me that he thought that what I was experiencing was a severe migraine attack and that I should see a neurologist. And I was skeptical at first because I said, okay, this is just a migraine. I don't need to see a neurologist for this. And it became clear pretty quickly that I did, in fact, need to see a neurologist. And I started having attacks once a week, then a couple times a week. Eventually, they went to every day. I started seeing a neurologist. I started doing all of the sort of typical things that you do when you're first diagnosed with migraine disease. And I kept finding that my particular brand of migraine disease was resistant to a lot of what we were doing. And so I kept looking for, different specialists and different doctors, because there were doctors who would say to me, there's nothing else that can be done for you. So we can keep doing this, but it doesn't seem like it's working. In one particularly memorable instance, I heard it would be a waste of your time and mine for you to continue coming here, because there was nothing else that doctor knew how to do. And I don't particularly blame that doctor, but it's a very scary thing to hear as a patient, to hear a doctor, especially a doctor who's in a specialty like neurology, say a finite statement like that. There's nothing else that we can do. So I got quite desperate, and I turned to Facebook, as so many of us do. And I put out a Facebook status. I said, I need a new neurologist or headache specialist. Somebody tell me what to do. And immediately some folks from the cluster headache community messaged me, and they said, if you're in Massachusetts, why are you not in Dr. Brian McGee's office? And I said, oh, because I didn't know he existed. And they said, send him a message, tell him who sent you. And I was like, this is odd, but okay. And they let him know to expect me. I got in to see him. That was 11 years into my chronic migraine journey. We walked in, I gave him my whole patient spiel, the story that you guys have heard, sort of the abridged version of here. And I said, I know that there's nothing else that can be done for me. I'm really here just to ask what we can do to increase my quality of life. Because at that point, I was bedbound most of the time. I was couch-bound on good days, and on the best days, I was making it to doctor's appointments. That was sort of the extent of my social interaction at that point of my life. And so I said, I know there's nothing else that can be done for me, but I just need an increase in quality of life. And he paused, and he looked almost angry, and he said, who told you there's nothing else that can be done for you? So I listed off several people, including headache specialists, neurologists, ENTs, different kinds of people I'd seen. And he said, I want you to hear me. There is never not anything else that can be done for you. There is never not anything else that can be done for you. He said, just in general, I can think of 4 things off the top of my head that haven't been offered to you yet. But even beyond that, even if you had tried those things, there are so many new things coming down the pipeline. There are so many different routes of administration. There are different dosages. Sometimes your migraine disease changes, and things that used to be effective become effective, and vice versa. And I looked over, my parents are crying at this point, and in that moment, before he had written anything on a prescription pad, before he had given me any kind of really treatment advice, he gave hope back to me and back to my family after 11 years of pain and trauma and darkness and depression and anxiety. And I feel like that's a really important part of the treatment plan, is hope. And I know that sometimes with patients who have very resistant migraine disease, it can sometimes be hard to inject that hope into a conversation. But if you're just willing to say, I'm not going to give up on you, or we are going to work together to figure out what we can do to at least increase your quality of life. Because at this point, a lot of us, especially those of us who are chronic, understand that there's not a magic bullet, that there's not a cure, that it's an incredibly complex neurological disease. So we just want to know that somebody is not going to give up on us and is going to be able to give us a little bit of hope. And with that single sentence, that is what Dr. McGee was able to do for us in my family. And I honestly don't know if I would be here today without that particular appointment and interaction. I also get asked a lot about what I refer to as my dream team, which is a group of healthcare professionals that work together to ensure that I am building a life worth living, as they say, in the kind of therapy that I engage with. So I have a primary care physician, Dr. Kate Atkinson, who is incredibly involved in my care. Her office is a mile from my house versus Dr. McGee's office, which is in Boston at Brigham and Women's. And so being able to have someone close to me in the area that I can work with in between my visits is really incredibly helpful. I work with a team of massage therapists when I'm able to afford that, because I'd found that after 15 years of living with chronic migraine disease, I was always really tightened up, bracing for pain. Sometimes I didn't even realize that I wasn't breathing. I was holding my breath, and it was very, I used to think that massage was a very much something you did when you got a birthday certificate, or if you were a person who had a lot of money. And so when I went and I explained to them the kinds of symptoms I had, the disease that I had, they were able to work with me in such a way that was very gentle and very helpful. And I thought that all massage was the same. I thought they were either good massages or bad massages. But working with them has been really transformative. I also work really closely with my pharmacist, which I think is something that's really important, because whenever I want to check about medication interactions, which of course I discuss with my doctors, I just think it's really helpful to have a relationship with your pharmacist if that's possible. And the reason that I talk about all these different people on my dream team is because I think they contribute to my mental health, knowing that there are people that can help me in all kinds of different ways and in all different kinds of areas of the state, I think have been really helpful for me. My therapeutic experience, I see what is called a dialectical behavior therapist, or DBT. And basically there's sort of 4 core modules to DBT. There's mindfulness, there's interpersonal effectiveness, emotion regulation, and distress tolerance. And it's sort of a skills-based group, a skills-based approach to dealing with panic attacks, dealing with different mental illnesses. And I found myself very grateful that I already had a psychiatrist and a therapist on the books by the time migraine showed up in my life, because I feel like they helped me learn how to grieve the loss of who I was. I felt like they were able to help me construct my new normal, which I know a lot of us in this room have had to do with our diseases. And they've also given me tools that help to relax me. I get a lot of anxiety during attacks, as I'm sure a lot of us do. And it's just been a really transformative experience for me to be able to go into a room and talk with someone and say, I'm really depressed today. I had a really bad attack. I had to miss, my brother's graduation, or I had to miss different things in my life, because those are things that it feels like migraine is taking away from us. And so to be able to have a place to process that, I have found to be really helpful. And I have found that mindfulness and meditation have been very helpful. They have not cured my migraine disease. There isn't a cure for migraine disease. But I find that there are some things that can reduce symptoms by 10% or a little bit. And if I stack them, sometimes I'm able to reduce by 30%. And if you're sitting at a 9 on the pain scale, being able to reduce it at all is a huge, it's just a really wonderful thing to be able to reduce it at all. And so the other thing that I've learned a lot about in therapy is that healing is not linear, which I know that a lot of us know, but it's also not a destination. I think a lot of us And I speak for myself, it may resonate with you, it may not. I looked at healing as, I'm going to get healed, I'm going to be healthy, I'm going to get there someday. And the fact of the matter is that I've learned that for me at least, I'm going to be healing for the rest of my life. And to me, rather than overwhelming, that gives me permission to slow down a little bit and not feel like I have to race to some sort of an end point. I've been very lucky in that one of the new anti-CGRP medications worked very well for me. So I do have significantly fewer migraine attacks than I did before. Something that I didn't expect though, as I mentioned before, I was diagnosed with depression after migraine disease. And so in my mind, I thought, okay, the depression is linked to the migraine disease. And if and when the migraine disease lessens or goes away, the depression will go away also. And I found that that's actually not really how depression works. And so I was experiencing all these reduction in symptoms, reduction in pain, reduction in all kinds of things, and I got very overwhelmed because I realized I didn't know how to structure my life. I had had migraine disease since 19, and this was last year that I started the new medication, so I was 34. So I had 14 years of really just missing some of the sort of stereotypical milestones that you go through at that age. And I felt guilty. I felt a lot of shame because I felt like I was wasting time being depressed when so many people had been hoping and praying and wishing for success with these medications. And so having a therapist on hand to talk about that was really helpful too, because I was able to say, I feel like it's unfair that this worked for me and not my friends. Or my friend who's a mom, she deserves this more than me because, she has kids to take care of. And there were a lot of strange feelings that came up, and having someone there already to help me go through that was really helpful. So I think a lot of times, as was mentioned earlier on, is that people feel like when they are asked to go to a psychiatrist or to a therapist, they sometimes feel as though people are saying that their disease is all in their head. And in some cases that may be what the person is saying, but in other cases I truly believe that it is to have a space to talk about the grief and the mourning and the learning how to restructure your life and coping skills and all sorts of things. And so I'm hopeful that we'll be able to sort of separate those two things, and that mental health and therapy will become a part of the treatment plan as much as anything else. And what I would say to you, just sort of in closing, is that advocacy has been a really important part of what has kept me going, and it's what's given me a purpose. In the beginning, when I first started having migraine disease, I started to write just to process my pain. And then I realized that if I put my writing out onto the internet, even if I am down in a dark room for a week, someone else might be able to find some comfort in my words that I've put out onto the internet. And eventually that came to be articles and blogging and videos and speaking and all sorts of different things. But there are many different ways to be an advocate. Showing up here today is being an advocate. Talking with your doctors and working on a partnership with them is being an advocate. I wear this tiny little button that's purple that says I have chronic migraine. People stop me constantly in the grocery store, in the airport. I know Dr. Matthew wears his Miles for Migraine shirts whenever he travels in airplanes and things like that. He calls it, is it Miles in the Sky, is that?
Mitts.
Mitts.
For migraine, so miles in the sky for migraine.
Yes.
I was gonna call it migraine sky miles, but then, Delta threatened me with a lawsuit, sky miles is their thing. Being dragged off a plane is not mine.
And so there are a lot of different ways, even just a reason every tweet is advocacy work. Even just sharing something that I've shared or a family member has shared, it doesn't have to be as public as the kind of work that I do. And the other thing I encourage is coming to events like this, these patient education days or the walk, run, relax days that Miles for Migraine does. Retreat Migraine, which is an event held by the Coalition for Headache and Migraine Patients. So there are a lot of different options for things that you can do. So I really appreciate all of you being here today. I hope that I've given you some hope or inspiration, some ideas to take home to your doctors, to your families. And I would love to talk to anybody afterwards who is interested, and I really appreciate all of you being here and listening to my story. Thank you so much.
Michelle, that was amazing. Great job. I think a lot of people can relate to your story. It was very kind of you to share your personal story. So it was a wonderful presentation. All right, next we are going to gather up some of your questions that you've written down, and we have our panel up here that is going to answer questions for you. There's